So the gold standard for urinary incontinence for men is the artificial urinary sphincter. The artificial urinary sphincter is a device that will basically restore continence regardless of the degree of incontinence. So if a man has complete incontinence, i.e. they completely lost their sphincter, either because the sphincter itself is no longer there or the sphincter got denervated. Let's say, for example, someone who had prostate cancer and they had their prostate removed and that injured their sphincter because the prostate is sitting right against the sphincter, and now they have complete incontinence. Well, there are several treatment options, but if they have the maximum amount of incontinence, which is total incontinence, then the solution is a artificial urinary sphincter. As opposed to, let's say they have a little bit of incontinence. Let's say they use 2 or 3 pads per day, and they have a little bit of incontinence or stress incontinence, then they might be able to get another procedure, which is, for example, a male sling. And this is, we put a mesh against the urethra to restore a little bit of that pelvic floor to allow them to restore some degree of incontinence, some degree of continence. But if they have a complete incontinence, then artificial urinary sphincter. What is it? Well, it was invented a while ago, and it has been going through various different versions, and the most recent version is actually quite good, and it's impregnated with antibiotics. It's a device that is implanted completely on the inside of the body. So if you look at somebody from the outside, you wouldn't know that they have a sphincter. And it has 3 components. The actual sphincter itself, which is a fluid-filled compartment that wraps itself around the urethra, right at the bulbar urethra, and it hooks up to a reservoir, which is actually a pressure, it's a pressure regulated balloon that has water in it, and that sits inside the body, and it hooks up to that with a tube, and then there's also a pump. It's a small little plastic pump that you basically can pump with your fingers, and that's the 3rd component. And the pump itself is also hooked up or connected to the sphincter and to the pressure regulated balloon with a tube, and sits in the scrotum. So how does it work? Well, the default position of this artificial urinary sphincter is on, meaning that during the day there is water in the compartment that surrounds the urethra, and this water is there filled up and putting a certain amount of pressure from the outside in on the urethra. And when the man decides to void, he goes to the bathroom, and what he does, he takes the pump, he finds the pump in his scrotum and then squishes the pump a couple times, and then when he does that, what happens is the pump is actually taking fluid from the sphincter and bringing it back to the pressure regulated balloon, to this reservoir of water that's actually placed inside the lower pelvis and the abdomen. So when it does that, now the sphincter is basically got the water sucked out of it and put back into the balloon. Now it's empty, and because it's empty, there is no longer pressure being pressed from the sphincter, the outside of the sphincter, onto the urethra. And now there's no pressure at all from the outside in on the urethra, and the urine can flow. Now, about a minute later, what happens is automatically the water gets back from the reservoir into the sphincter surrounding the urethra. And the way that this happens is because the pressure regulated balloon is not just a reservoir of water, it's a compartment which has intrinsically a certain amount of pressure calculated and engineered into it, that even if you don't do anything, it's always trying to squish to empty. But so basically, as soon as the water went into it, it was actually already started bringing the water back into the sphincter. So basically what happens is the man activates the pump a couple of times, that gets the water into the pressure regulated balloon. As soon as he stops, already the water started trickling a little bit at a time into the sphincter. However, it does it so slowly that it takes about a minute until the water is back into the sphincter. Okay, it takes about a minute until the water is back into the sphincter. But as soon as it's back into the sphincter, that sphincter is inflated, and now the water won't pass through anymore. So it's a pretty cool mechanism, and it allows for a man to void. It gives him a minute to void. A minute later, he's already back continent. A minute is, more or less to allow enough time for the bladder to empty. So that's about the artificial urinary sphincter.